Track your pregnancy week by week and learn more about symptoms, baby's development, and self-care tips as you prepare to meet your baby. A typical pregnancy normally lasts from 37 to 42 weeks, counting from the first day of your last period. The 40 weeks are divided into trimesters, with each one lasting for 3 months, or around 12 to 13 weeks. When you're pregnant, your body will go through a number of important changes to support your developing baby and get ready for childbirth. Here we outline what you can expect during the different stages of pregnancy. Getting pregnant. Getting pregnant means a sperm from your partner has joined together with one of your fertilized eggs. The moment when this happens is called conception. An egg is released from one of your ovaries every month, usually around 14 days after the start of your last period. This is called ovulation. If you've had sex, the egg may be fertilized by sperm from your partner in your fallopian tube. The fertilized egg then travels along your fallopian tube towards your womb, uterus. During this time, the fertilized egg rapidly grows and divides, becoming a ball of cells. Once it reaches your womb, the ball of cells buries itself into the womb lining. This process is called implantation. It takes around 5 to 8 days for your fertilized egg to travel from your fallopian tube and implant itself into your womb. At this early stage, the baby that starts to grow in your womb is known as an embryo. Usually, your womb sheds its lining every month, causing your period. This is usually around 14 days after ovulation. When you're pregnant, your womb won't shed its lining, so you'll stop having periods. Missing a period is often the first sign that you're pregnant. Pregnancy tests. You can buy pregnancy tests at any pharmacy or supermarket. You may also be able to get one free of charge from certain charities, contraceptive and sexual health clinics, and your GP. Pregnancy tests work by detecting a pregnancy hormone called beta-human chorionic gonadotropin, HCG, in your urine. Most pregnancy tests can detect if you're pregnant from the first day of your missed period. Some tests are more sensitive and are able to give you a result even earlier. Pregnancy tests are usually very accurate, but a negative result may not be accurate if you do the test very early on. It's worth repeating a negative test after a few days because during the first few weeks of pregnancy, your level of HCG increases rapidly. By the time your period is about a week late, you can be pretty sure that the result of a pregnancy test is accurate. How many weeks pregnant am I? Pregnancy is counted from the first day of your last period. So if you have a 28-day menstrual cycle, you're said to be 4 weeks pregnant on the day your next period would have been due. If it's been a week since your period was due, you'll be 5 weeks pregnant. Your doctor or midwife will calculate your due date based on the date you started your last period. Your due date is 40 weeks from this date, although it's normal to give birth up to 3 weeks before or 2 weeks after this date. First trimester, 1 to 12 weeks. Effects of pregnancy on you. Your body goes through many changes in early pregnancy. The following may be some of the first signs that you're pregnant. Missing your period. This is often the first sign that you're pregnant. Your breasts may feel fuller and tender, and your nipples and the area around them, the areola, may become darker. You may find you need to pass urine more often as your womb gets bigger and starts to press on your bladder. You can feel very tired and drowsy as a result of all the changes happening in your body. You might get pulling pains around the sides of your abdomen as your womb grows bigger and stretches the ligaments around it. You may feel sick or vomit. This is often called morning sickness, but it can happen at any time of the day. It's very common early on in pregnancy. It can help to eat little and often and stick to blander foods. See our Pregnancy Problems and Complications article for more information. It's common to get constipation during pregnancy because the passage of food through your digestive system slows down. Make sure you're drinking enough fluids and include plenty of fiber in your diet. See Pregnancy Problems and Complications for more tips. Many of these symptoms will settle down as your pregnancy continues, but some things like constipation may carry on or get worse. You may already be following a healthy lifestyle, but if you're not, there are a number of changes you should make when you become pregnant. This is important so that your pregnancy is as healthy as it can be. These changes include giving up smoking if you smoke, and stopping drinking alcohol if you normally do so. You should also be careful about what you eat and make sure you take folic acid and vitamin D supplements. Read our information on planning for pregnancy for more detail. How your baby develops. Your baby begins life as a rapid-growing, tiny ball of cells that quickly develops into an embryo. During these first few weeks, all your baby's organs and important body parts begin to form. Some of the cells develop into the placenta, which creates a lifeline between you and your baby. The placenta attaches itself to your womb and is linked to your baby by the umbilical cord. Oxygen, nutrients, and hormones from your blood are transferred through the placenta and umbilical cord into your baby. Waste products from your baby are transferred back into your blood so you can get rid of them. The cells that start to form your baby's heart start making beating movements from very early on. Your baby's heartbeat can usually be detected during an ultrasound scan around the 6th week of pregnancy, second trimester, 13 to 27 weeks. Effects of pregnancy on you. Your pregnancy will become more visible during your second trimester. Exactly when this happens varies from woman to woman, but most women look pregnant from around the 20th week of pregnancy. Here are some other changes you can expect during your second trimester. You'll start to put on more weight as your baby grows. The exact amount varies from woman to woman, but it's usually around 9 to 11.5 kilograms, or 20 to 25 pounds, throughout your pregnancy. The extra weight is made up of your developing baby, the placenta, the fluid in your womb, your breasts, and extra fluid and fat stores. As your abdomen and breasts grow, you may notice stretch marks on your skin. These are harmless and usually fade after your baby is born. You can try different moisturizers and lotions to prevent stretch marks, but there's little evidence that any of these work. Morning sickness usually gets better by the time you're 16 weeks pregnant. Pregnancy hormones cause your ligaments and tendons to relax, loosening your joints. Combined with the extra weight you're carrying, this may result in backache. You may also get pain in your pelvis and have some difficulty walking. You may first feel your baby move when you're around 18 to 20 weeks pregnant. It may be a few weeks earlier if it's not your first pregnancy. The movements become much more vigorous and obvious as your baby gets bigger and stronger. How your baby develops. In your second trimester, your baby's organs continue to grow and mature. Your midwife will be able to hear your baby's heartbeat with a stethoscope from around 16 to 20 weeks. Your baby's kidneys will begin to work and pass small amounts of urine. Their ears develop, and by 16 weeks, your baby can start to hear some sounds. Your baby's skin will be wrinkled and covered with a greasy substance and fine hair called yanugo. He or she will sleep and wake regularly and may start to kick and stretch. They may even suck their thumb if their hand reaches their mouth. Their eyelids will open by the time they're about 6 months. By the 20th week of pregnancy, it's usually possible to see on an ultrasound whether your baby is a boy or a girl. From 24 weeks, your baby starts to have more chance of surviving if they're born prematurely, but they would need intensive care for a long time if they were born this early. Their chances of surviving improve with every week they stay inside your womb. Third trimester, 28 to 40 weeks. Effects of pregnancy on you. Here are some of the main changes you can expect in your final trimester as your baby continues to grow and your body prepares for childbirth. The extra weight you're carrying can make you feel tired, and you might become breathless as your baby grows. Sometimes these problems are caused by anemia. You should be offered blood tests at your first midwife appointment and again when you're 28 weeks pregnant to check for this. You might be finding it hard to sleep, which will also make you tired. It's common to wake up a lot in the later stages of pregnancy because needing the toilet more often or feeling uncomfortable can disrupt your sleep. You might get Braxton Hicks contractions, where your womb starts to contract from about 30 weeks onward. These may be uncomfortable but shouldn't be painful. It's common to get heartburn in pregnancy, and this is more likely to affect you in the third trimester. Try to eat little and often and stick to bland foods. Avoid eating late at night. You can try an antacid medicine to see if it helps. Many pregnant women suffer with swelling later in pregnancy, especially in their ankles, feet, legs, hands, or fingers. If this happens suddenly or gets significantly worse, contact your midwife because it can be a sign of preeclampsia, high blood pressure during your pregnancy. It's also common to develop varicose veins at this stage as the blood flow around your legs slows down. Your breasts will start to produce a milky fluid called colostrum towards the end of your pregnancy. You might notice that your breasts start to leak some of this fluid. You may find you need to pass urine more often as your baby descends into your pelvis. You may lose some bladder control too, for instance, passing urine when you cough or sneeze. This is known as stress incontinence. How your baby develops. By this point in your pregnancy, most of your baby's major development is complete. During this trimester, your baby gains weight very quickly and develops fat stores beneath their skin. Their skin starts to smooth out and they lose their coat of fine hair. Their body gradually becomes more in proportion. Their lungs mature but won't work properly until they're born. Your baby usually turns into a head-down position ready for birth. In the last few weeks, they drop lower into your pelvis. Thanks for watching my video. Please subscribe to my channel and activate the notification bell to receive all new videos.